Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show for this evening, Friday in August. Man, I forgot what date it is. Friday, August 24th. I should know that because it's the day after my birthday. Man.
Happy birthday.
Thank you. That's Dr. Mohamed Osman. I'm welcoming him to the program. Welcome to the program, Dr. Osman.
Thank you for having me.
Dr. Osman, and thank you for, joining us on this adventure of health, because we always like to bring the latest in healthcare news to South Florida. So Dr. Osman is an interventional cardiologist, and we're going to have him explain the difference between cardiology and interventional cardiology, because as a general public, we always have that question. But he's going to join me also he's got an upcoming lecture at Florida Medical Center, the Heart and Stroke Every Second Matters lecture on Wednesday, August 29th from 6 to 7 p.m. in the Florida Medical Center Auditorium, 5000 West Oakland Park Boulevard in Lauderdale Lakes. So we'll give out the info for that. You can register, get a seat there. It's an hour of very informative talk about the heart and stroke, which is so important nowadays with everything that's tied into it as well. So with I do have a couple quick announcements. I just wanted to share Dr. Stuart Himmelstein, who's been on this program many times. He's actually in the line for a kidney. He needs a kidney, so he's got a donor possibly lined up. This has kind of been going on the last few years, so we have our fingers crossed. It's set up to help. He has a GoFundMe page set up to help with the cost of travel with the living donors. So I'm going to give out the info a few times. It's www.gofundme.com/Stu039S-New Kidney Fund. And if you just search Dr. Himmelstein, Dr. Stuart Himmelstein on Facebook or Google, you'll see the page come up. So we'll mention that as well. So I just want to get that news out there as well. But once again, Dr. Osman, welcome to the program. So you're an interventional cardiologist.
Yes.
And that's a little different than just when we, see maybe cardiologists on the door of an office. What's the difference, and what are some of your specialties or areas of interest?
So an interventional cardiology is a subspecialty of cardiology. So usually in order to get there, you have to go through a formal cardiology training. A standard cardiology training is about 3 years.
Okay.
After that, you have the option of subspecializing within the field of cardiology. There are different disciplines you can choose from, like interventional cardiology, electrophysiology, structural heart, congenital heart. There are different disciplines that you can choose to subspecialize within the field of cardiology. The field of cardiology is expanding. It's huge. It's a wonderful field. So because of the magnitude of the technical advancement, it's just too big to be under one umbrella. So they have to break it down into different disciplines.
And you're the type of doctor that's also called from time to time when there's an interventional approach needed. Okay. So that's like a minimally invasive, more catheter-based approach through arteries or veins? Would that be correct?
That's correct. That's correct. So an interventional cardiologist is someone who can intervene and do heart procedures through minimal invasive approach. So a standard way of doing this is getting access to a blood vessel in the body, whether it is in the wrist or in the groin, and then through that you can advance catheters to the heart or other organs of interest.
Unbelievable.
And then start doing things. I like to think about it like the heart is the center of the body, like Times Square, if you will.
Oh, yeah, that's a good point.
And then you have streets leading to that. So we take one of the streets, streets being blood vessels, and that will lead you to the heart, and then you can deliver equipments there and do all what you want to do under X-ray guidance. So that's basically what we do.
And that is much different than the surgical approach that was done for years, open. Correct. Which sometimes would include correct me if I'm wrong, a sternotomy or a different type of incision as well.
Yeah, correct. So what happened is we have different specialties, and they all address more or less the same problem from different approach.
Okay.
So
it's a good way of putting it.
A cardiac surgeon, for example, they use knives, they use scalpels, and they cut through tissues to reach their target, being the heart or other organs, and then do what they have to do. For an interventional cardiologist, we do not cut. We just use needles. So surgeons use knives and scalpels. Interventional cardiologists use needles. We just use needles to get into an artery or a vein, and through that, we can deliver our equipments to the heart and do what we have to do.
So in some cases, that's maybe a balloon or a stent that we've heard of? Is
correct.
That, okay.
Or even something bigger than that.
Yeah.
Yes.
Oh, really? Okay.
Yes. There is a whole set of things we can talk about.
Yeah, we could have a whole nother show just on that. Thanks for explaining that, because, without having a doctor here and, you hear about it and you read about it, but
Sure.
It's unbelievable having your perspective, and that's why we love doing this show. That's why it's great. So again, once again, Dr. Mohamed Osman, he has an office with Tenet Florida Physician Services, website profile on tfpsdocs.com. Find him there. You're over in Plantation, 817 South University Drive, Suite 104 in Plantation. And you're on staff at a whole bunch of hospitals, mostly Florida Medical Center, but also North Shore Medical Center in Miami, which we have a lot of physicians actually drive up here from there. Yeah. So that's great. We love it when they come by. And are you also at Palmetto General Hospital in Hialeah?
Correct.
3 hospitals.
Correct.
Wow. You have busy weekdays and weekends, huh?
Yeah.
Okay. So thank you for, again, explaining interventional cardiology. So we'll go on a little bit. So September is right around the corner. It's actually Atrial Fibrillation Awareness Month, so AFib Awareness Month. And that's a topic the last few years that has just totally come to the forefront in the cycle of news. I mean, I tell you, 6-7 years ago, I didn't even know what atrial fibrillation was. I would hear it once in a while.
Yes.
But now it's like almost a mainstream term in AFib. And now, is that the irregular heartbeat or heart arrhythmia that goes on?
Correct.
And the problem with that, and I think you're going to talk a little bit about this in your lecture maybe, is that can cause a stroke.
Correct.
Right?
Correct.
Wow.
Correct.
Okay. So that's an important time to kind of learn about that, learn about some of the signs and symptoms. Sometimes you have to see a cardiologist or interventional cardiologist because it could be symptomless, right? It could be no symptoms sometimes.
So I like to think of any disease condition as a spectrum.
Okay.
And you can take that and apply it to anything. Let's take a simple example. Let's take cold. You can just have a little bit of headache, a runny nose, and that's about it. And you can be very sick in a hospital in an intensive care unit. And like the flu, think about the flu. You can have a flu with mild symptoms, runny nose, headache, body aches, that you treat at home even without anything, just take some Tylenol and that's it. Or it can be a life-threatening condition in an intensive care unit in a hospital. This is a flu and this is a flu, and the difference is day and night. So any clinical condition, you can take it and apply the same idea, a spectrum from the most mild to the most severe and everything in between.
Okay, and yeah, there's a lot of different ailments that come right off that spectrum as well. Another term that's also been in the news a lot, and I think there's an awareness month, it may even be September as well, I got to take a look here while we're going, is peripheral arterial disease.
Yes.
That's something that's very serious as well, because if you'll explain a little bit, it has to do with the blood flow to different portions of the body, maybe down to the legs.
Correct.
As well.
So a little bit of numbers. There is between 8 and 12 million people living here in the U.S. with peripheral arterial disease. And many people don't even know it. So again, it's the same idea of a spectrum. So you can have a peripheral arterial disease and you don't even know about it, or you can have the other end of the spectrum when people start having gangrene and lose limbs. So that's a wide range of presentation, and we like obviously to identify these conditions and hopefully treat it appropriately. You can avoid a lot of a lot of issues, especially when it comes to quality of life. If somebody can't even walk, or even worse, if somebody lose a leg, that can have a life-changing experience for a patient. So we try always, number one, prevention, and if we cannot prevent it, at least we try to identify the disease in its early stages and hopefully do something about it before we reach a late stage of the disease.
Like if you can't prevent it, treat it, get it on a plateau.
Correct.
So it's not getting worse as well. Because losing limb, I've done a little bit of research on that, and the death rate is a little higher, as it's actually a lot higher than someone who hasn't lost a limb.
And most of those patients actually, when they die because of heart disease, not because of their peripheral vascular disease. Heart disease and peripheral vascular disease are closely intertwined together. And most of the time when a patient has peripheral arterial disease, they have a coexisting heart disease that they might not be aware of.
Once again, they're connected, just like you said with AFib as well.
Exactly.
They're both connected as well. And again, we're here with Dr. Mohamed Osman. A fascinating conversation so far on interventional cardiology and the heart as well. Dr. Osman's practice is implantation. Been there a few years, very established practice as well.
Right.
So that's great. That's always good to mention. You're not moving around. You're in the community.
Yes. Yes.
I know you're very well respected. I'm so glad you made it to the program today.
Thank you very much.
Now, how did the lecture at Florida Medical Center come about? How'd you come up with the topic? Why now? And it's a great opportunity for the community to come 6 to 7 p.m. Everyone can get there in a way.
So I strongly believe in prevention.
Okay.
If you can prevent a problem, it is much better to deal with that problem in a controlled setting rather than in an emergency. So to give you a little bit background about that, we as interventional cardiologists, we get called any time from the hospital as an emergency if somebody comes in with a heart attack, and we need to go in minutes notice and start doing things to stop that heart attack. We even time ourselves by minutes. The national standard of treating a patient with certain kind of heart attacks is 90 minutes, and here in South Florida we try to hold ourselves to a higher standard, and we set it at 60 minutes. So you have
That's great.
You have minutes to do this. Now, you can do this whenever it happens. You can do it at 2 o'clock in the morning, 3 o'clock in the morning. The question is, isn't it better to prevent that from happening to start with?
Yeah, overall from even happening in the first place.
Correct.
Dr. Osman, hold that thought just a second. We're going to take a quick break.
Okay.
And on the other side, talk a little bit more about interventional cardiology in the heart, maybe more ways we can prevent seeing problems with heart disease on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back on the How to Stay Healthy show with Dr. Mohamed Osman, interventional cardiologist. We're so happy to have you on the program, Dr. Osman, and your expertise and explanations. Thank you so much so far.
Sure.
As well. Let's talk a little bit more about prevention. So obviously you got the team in place, Tenet Heart and Vascular Network, great program, hospitals, cardiologists, cardiac surgeons, etc., vascular surgeons. National average, you mentioned a little bit, 90 minutes, and you guys have cut that down to 60. But in the first place, like we were talking overall, you'd rather not see us, as at all,
Yes.
because you'd rather talk to us about prevention.
Correct.
And
Correct.
what are some of the things that we can start doing on September's atrial fibrillation month, and PAD awareness month is around the corner as well. What are some of the things we can do, whether it's diet, exercise, not being sedentary and sitting all day like a writer like me and just sitting 8 hours a day?
Yes.
What are some of your recommendations?
So I firmly believe that if we change the way that we organize our day and the way we handle food, I think we can prevent a lot of these problems. I know that we can prevent a lot of these problems. The problem is, to change one habit is not an easy thing. Changing habits is always challenging for all of us. But for those among us who can change habits, it can have a huge impact in their life and health. The way we eat is a big deal. I'm not talking about starving ourselves.
Talking about the portion size in America.
I like to think about it in terms of quantity and quality. The quantity that we eat has to go down. Everything is supersized, and the quality has to go up. So one thing goes down, the other thing goes up. And I think if we can achieve that balance, we will do much better when it comes to food. Exercise, it sounds like a cliche, but it is so essential. So if you talk from heart point of view, from peripheral vascular point of view, from diabetes point of view, from high blood pressure point of view, all of these things respond so nicely to exercise. I have seen and I have treated patients who my first encounter with them was a situation of a massive heart attack, and it triggered certain ideas for those patients that they need to change certain things about their life, and they change, and I can see that change. Many of those patients can go back and have a perfectly normal life, which is kind of difficult to imagine. After a massive heart attack, you still can have a normal life and even a normal life expectancy. That can happen, but it doesn't come for free. It comes with a change, a real change in the way that we conduct our daily activities.
That's great to hear, Dr. Osman. And there's still change for, all time to change for all of us. And now you're in great shape. You live in the same society community that we all do. What are some of the things that you do to stay in such tip-top shape? I know that's important to you because you want to portray that image to the people that you're talking to, your patients.
Right. I find it hard to advise my patients to do something that I'm not doing on a personal level. That's one thing. But besides that, I know also that in order to stay in good health, you need to do certain level of activities. So even though my time is very tight, I try to carve out some time from my daily routine for exercise. So I go and I go for a fitness class, and I go with that. And that's a good point, because if you join a group of people when it comes to exercise, it improves your compliance. So it's a classic scene when it comes in January and everybody is out walking in the street. February, it starts to dwindle
the
down.
gyms are full.
By February, it starts dwindling down. By March, everything is back
Right
to
now,
normal.
it's so hot, no one's even out.
Right. But when you join a group or a class or something like that, the atmosphere of a class improves people compliance.
Okay, it's easier to do with a group as well than just by yourself.
Correct. And the motivation part, which is a big part of that.
Yeah, and I'm just thinking right here as we're having this conversation, you're on staff at 3 hospitals. You run a very busy practice as well. Interventional cardiologists as a whole are busy because they're specialized, and you find time to eat right and to exercise. So like, there's really no excuse anymore.
I like to think about it as carving out time, because many times, and for most of us, we are so busy with our daily life that we don't have time. But you have to carve it out and just put a red line. This is what I'm going to do in this time, and that's it. You block the time.
And I remember the first thing you said on that segment right there was organize too.
Yes.
Think about it, plan it ahead of time. That's great. Let's keep this conversation going at Dr. Osman's Heart and Stroke Every Second Matters lecture at Florida Medical Center. It is a lecture, so you're going to give out info, but there's also a Q&A interactive session, so we can all talk about this. For members of the community, you can bring questions, Dr. Osman, about the heart and stroke, which do tie in. You know, we have a lot of neurologists on this program, but, you know, the stroke ties into the heart as well. Because a stroke is a brain attack, where like a heart attack is problem with the heart. AFib, I'm sure will come up in that conversation, irregular heartbeat, heart arrhythmias as well. Again, that's going to be August 29th, so next Wednesday already.
Correct.
6 to 7 p.m. in the Florida Medical Center auditorium. I have some info, so a way you can get a seat there. You can call Florida Medical Center's line for this at 844-502-7051. Pre-register, and they'll reserve a seat for you. I've seen lectures at Florida Medical Center, very informative. The auditorium, easy to get in and out of. Great time to hit it there. That time of the day, there's a lot of parking, 6 to 7 p.m. No, I've been there midday. It's not bad.
No, not at all.
As there's some other hospitals in South Florida that are a little tough.
Yes.
But the panelists are Dr. Mohamed Osman, who we have here, interventional cardiologist. Peta Bowen, and I hope I'm pronouncing that right. She's an RN registered nurse. Arlene Barrett, MSN, and Ilana Brown, MSN. So that's going to be great. I imagine that's some of the team that you work with at the hospital.
We have an amazing team at Florida Medical Center. We have a heart team, amazing people with excellent training, excellent skills, excellent personality. I can't ask for any better people to work with. And they do a fantastic job. We have the heart team, the neurology team, the stroke team, excellent people, and they provide what, in my mind, a world-class service for our community.
It's a great heart hospital. We have a lot of doctors. We're so lucky. You know, during certain time of the day, traffic isn't too bad. We can get a lot of doctors over here on these shows, even though we broadcast from Boca Raton as well. But we're all over South Florida and global. And it was also, I found out through interviewing a lot of doctors from your hospital there, is that it was the first hospital to ever do open heart surgery, I believe, in Broward County, 1974. I'm pretty sure we have that right. It was known as the Heart Institute of Florida.
Still
is. It's the hospital you see right off the turnpike, but it's actually sits on Oakland Park Boulevard. So you take I-95 and you just get off Oakland Park Boulevard and head west, and you can't miss it right before the turnpike. Great hospital for cardiology, cardiac surgery, orthopedic surgery as well. We've had the bariatric surgeon on the program as well, and general surgery. Just a great hospital. I have a lot of endocrinologists who come on the program and talk about diabetes from that hospital. So we're so happy to have you. And again, the Heart and Stroke Every Second Matters next Wednesday, August 29th, 6 to 7 p.m. at Florida Medical Center. It's a free event, free community education. We just ask that if you have the time, please register so we can make sure they have a seat for you, 844-502-7051, or you can check out floridamedcenter.com online. That's floridamedctr.com. And once again, Dr. Mohamed Osman, interventional cardiologist with us. Why did you decide to, you went to medical school and then decided to go with becoming a heart doctor? And what is it with the heart? You could have been, I guess there's different roads you can go after medical school, maybe residency.
Correct. So it's one of the few specialties that you can do something and see an immediate result to what you do. So it was mind-boggling for me when I was still a resident and I see a patient coming in with a heart attack in a potentially life-threatening situation, and they go in that room in the hospital, we call it the cath lab, and they come out as if nothing happened. That was for if there is a definition of magic in medicine, that would be it. The response to the treatment that is almost immediate just was way intriguing for me to let go by. So I decided that I'm going to go for that and train for that. It was a lot of time, but I think it's worth it 100% for me. I have 110% job satisfaction.
That's great, and you're very passionate about your field, and that's so important as well. And we're lucky to have you here in South Florida. What are your hobbies and passions outside of medicine? I know you're very busy, probably in the hospitals and at the office, but anything else?
Beyond work and family, I try to do other things. For example, I like to read history. History is my passion outside medicine.
Me too. I have a minor in history. We're going to have a conversation one day.
So I really think that reading through history is number one, fun. And number two, we can learn a lot about what other people did in the past. So hopefully we can avoid their mistakes. I might say that I think all politicians need to have a major in history.
Yeah.
I think it will be quite helpful if they do that.
Thank you for saying that as well. Couldn't have said it better. Again, Dr. Mohamed Osman, check him out. He's got a website profile, tfpsdocs.com. Just type in Osman in the search bar. Dr. Osman, double board certified cardiology, interventional cardiology, fellowship trained in interventional cardiology, cardiology, and critical care. Check out Dr. Osman's bio. I mean, NYU, went to medical school in Cairo, Egypt. Just amazing. Thank you so much for sharing so much information.
Thank you.
We'll have to have you back on the program, and check out Dr. Osman at his lecture Wednesday, August 29th at Florida Medical Center, 6 to 7 p.m.
Thank you so much, David. It was fun.
Thank you. It was a lot of fun. I appreciate it, and you explaining everything.
Sure.
We'll see you next time.
All right. Bye.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly